Hello and welcome. My name is Mark Blatstein, the physician founder of Physician Presentence Report Service. Today I'm going to be discussing medical copayments that are going to be required for certain times that you request to have medical care where the Bureau of Prisons feels that it's not required. It's part of Attachment G. The program statement is 63031.02, excuse me. So they have sick call after hours requests to see a healthcare provider. But when you want to see that healthcare provider, if you ask a non-medical staff person to contact medical, well, then if the reason is not one of those listed in the next eight options, then you're going to have to pay. For example, if the healthcare services is based on healthcare staff referrals, well, if it's a non-medical staff person, then you're going to have to pay. If the healthcare staff approve the follow-up care, okay, then you're okay. If it's a medical preventive healthcare services actual visit, then it wouldn't be considered after hours. You may have to pay. If it's an emergency service, in other words, you've been shot, you've been knifed, you're having a heart attack, you're having a transient ischemic attack, that'll qualify. But I don't know that that is the reasoning here. If you have a prenatal care and you're concerned, all understand that the Bureau of Prison staff is short staffed nationwide. And with that comes the individual wardens have to use their existing staff, be it teachers or nurses, to sub in as correction staff. And so you may not have had the actual care that you needed during the day, but now you feel you need it. This will go along with diagnosis or treatment of chronic infectious diseases. You may have an issue that hasn't been brought up. Maybe it's the first time. Maybe you're worried. Maybe it's something I haven't covered. But if the doctor or nurse or whoever is manning sick call determines otherwise, you're going to have to pay. And then there's substance abuse treatment. And I've covered this in other videos and it's on my website. But for the most part, the Bureau of Prisons does not cover those that are coming in who are strongly addicted to narcotics, to opiates, to alcohol. On paper, they have a process for how to treat these individuals. But and you can find that in the article that I wrote that was published in the Federal Lawyer regarding the pre-sentence report, which is I also have in my website. But they are not actually prepared to person by person spend the time and they don't have all of the medications to literally go through and care for you. And so that's a problem. And then lastly, if you are responsible for harming another individual where they need medical care, you're going to be charged $2 for each of their visits. I hope you found this helpful. I appreciate you taking the time to listen out of your busy day, and please stay safe.